4-year curriculum for the MD program at the John A. Burns School of Medicine begins with 2 years of preclinical work divided into 8 units, each based on a specific system. Years 3 and 4 of the curriculum are clinical-based, where students participate in clinical activities in hospitals and clinics throughout the Hawaii community. Let's dive in and take a closer look at each year. First year at JABSOM is divided into 4 system-based units and incorporates the problem-based learning model, lectures, clinical skills, anatomy, and community health. Problem-based learning tutorials, or PBL, is at the center of our learning, where students meet in small groups led by a faculty or community physician. The groups meet twice a week to work through mock patient scenarios, where they learn to identify the problems being presented, make hypotheses of potential diagnoses, and work through the scenario as if they were a provider. Throughout the process, students determine specific topics from the case they wish to learn more about. These may be clinical, basic science, populational, or behavioral learning issues. After dividing the list of topics amongst the group, each student will research their assigned topic, create a handout, and present their findings with their group mates at the next session. The PBL model is unique, collaborative, and engaging, and pushes students to start thinking like physicians. In addition to the tutorials, JABSOM students have twice-weekly lectures, which help complement the PBL process. The lecture series allows students to dive deeper into some complex topics, such as biochemistry, pharmacology, and immunology. These lectures are often taught by practicing physicians and basic scientists who are experts in their respective fields. By the second unit, students are introduced to the anatomy lab, where they participate in weekly dissections and learn directly from their silent teachers or body donors. The JABSOM Anatomy Department is at the forefront of anatomy education, integrating augmented and virtual reality programs into the gross anatomy labs, as well as incorporating MR scans of the silent teachers into case studies. Each year, to show their appreciation to the donors and their families, the first-year medical students coordinate a memorial service to honor their silent teachers. This beautiful ceremony represents how each donor is valued, honored, and respected throughout their time as teachers. Another unique part of JABSOM's curriculum is the early introduction to clinical skills. By the second unit, students are learning and practicing the basic physical exam with one another and even practicing on real patients. During each unit, students have standardized patient experiences, where they practice their interviewing and clinical skills with volunteers from the community. Their encounters are often recorded for later viewing and feedback sessions. Students also get hands-on experience in the Sim Tiki Lab, where program mannequins help to play out real-life scenarios and create a safe learning environment. During their first 2 years, JABSOM students are also assigned a longitudinal clinical mentor, who is a practicing physician on the island. Students meet one-on-one with their mentor a few times each unit to learn directly from these providers and their patients. This not only allows for great hands-on experience, but also fosters mentorship within the medical community. Another piece of the first-year curriculum is known as community health, where students work weekly with a community organization for their entire first year. It is an incredible opportunity to engage with and give back to our community. Programs range from working with geriatric patients to mentoring high school students to spending time with pediatric patients in the hospital. There's really something for everyone. The community health program also includes a colloquium each unit, where students learn about other aspects of health and well-being that their future patients may participate in, such as yoga, acupuncture, tapping, and other forms of alternative medicine. An introduction to traditional Native Hawaiian techniques such as lomi lomi, ho'oponopono, and la'au lapa'au are also included. The second year of JABSOM's curriculum looks very similar to the first, consisting of PBL tutorials, lectures, anatomy, and clinical skills. During the first 2 years, optional electives in a variety of disciplines are also offered to students. These may include pediatric seminars, research opportunities, nutritional modules, and ultrasound workshops. The 8th and final unit of the pre-clerkship years does not include lectures or tutorials and is set for designated study time for the boards. This 10-week period at the end of second year allows students to focus solely on their preparation for their Step 1 board exam. The JABSOM curriculum is based on a pass-fail model, and there are no class rankings. This allows for a collaborative, community-based environment where students work and study together. During pre-clerkship years, there is a non-graded midterm given each unit to allow students to gauge their studying. Evaluation for each unit is then based on graded final exam scores. Students transition from the classroom and PBL setting to clinical clerkships in their third year. Students are assigned to a preceptor in family practice, internal medicine, obstetrics and gynecology, pediatrics, psychiatry, and surgery, and follow these preceptors in a longitudinal fashion for several months. Compared to the block-based rotations, this model allows for longitudinal relationships with patients, preceptors, and healthcare systems, and has been shown to increase students' learning and clinical independence. Third year also includes monthly colloquia sessions, where students learn about other aspects of the healthcare system and prepare for their career in medicine. Topics range from how to best prepare for residency interviews, to health economics, to more clinical skills, such as reading chest x-rays. Clinical senior rotations, along with senior seminars, take place during the fourth year. Students are required to complete rotations in emergency medicine, as well as geriatrics and palliative care, and may spend up to 24 weeks in electives of their choosing. It is a year for students to explore potential careers in medicine and other disciplines before graduation. Throughout the JABSOM medical school experience, learning communities play an important role in the curriculum. Each student is assigned to a designated community, which is comprised of JABSOM students from all 4 years, along with faculty advisors. These groups meet several times throughout the year and participate in activities or discussions around medical ethics, professionalism, culture and community, health systems, wellness, and clinical skills. That concludes our brief overview of the MD program curriculum here at the John A. Burns School of Medicine. We hope you learned more about JABSOM and all it has to offer. Thanks for watching.